Canine Parvovirus treatment, clinical management and therapeutic approaches. Canine parvovirus remains a significant threat to dog populations worldwide. Effective treatment combines supportive care, fluid management, and antimicrobial therapy to improve survival outcomes. Understanding canine parvovirus and its clinical significance. Canine parvovirus, scientifically known as carnivore protoparvovirus 1, emerged as a serious pathogen affecting dogs in the 1970s and rapidly spread across the globe. This highly contagious viral infection gained prominence due to its devastating effects on canine populations and continues to represent a substantial clinical challenge in veterinary medicine. The virus specifically targets rapidly dividing cells, particularly affecting the gastrointestinal tract and bone marrow, leading to severe illness and potentially fatal outcomes if left untreated. Understanding the nature of this pathogen is essential for veterinarians and dog owners to appreciate why prompt and aggressive treatment is necessary when infection occurs. Pathophysiology of canine parvovirus infection. The pathophysiology of canine parvovirus infection involves a cascade of cellular destruction that creates multiple systemic complications. The virus preferentially infects epithelial cells lining the gastrointestinal tract, causing extensive mucosal damage and disrupting the normal protective barrier of the intestines. This destruction leads to severe diarrhea, often hemorrhagic in nature, and allows secondary bacterial translocation into the bloodstream. Concurrently, the virus attacks hematopoietic cells in the bone marrow, resulting in leukopenia, a critical reduction in white blood cell counts that dramatically impairs the animal's immune response. The combination of intestinal barrier failure and immunosuppression creates a particularly dangerous clinical scenario where infected animals become vulnerable to life-threatening secondary infections. Core principles of parvovirus treatment. The foundation of successful parvovirus treatment rests on supportive care rather than direct antiviral therapy. Since no specific medication can eliminate the virus from infected animals, clinical management focuses on maintaining vital organ function while the immune system gradually controls viral replication. This approach requires hospitalization in most cases and intensive monitoring of the patient's condition. Veterinarians must balance aggressive intervention with realistic assessment of each patient's prognosis based on factors including age, initial viral load, and development of complications. Key points: aggressive intravenous fluid replacement to combat severe dehydration from ongoing fluid losses. Prevention and treatment of secondary bacterial infections through judicious antimicrobial therapy. Nutritional support once the gastrointestinal tract demonstrates recovery capacity. Electrolyte and acid-base balance restoration to correct severe metabolic derangements. Fluid therapy and electrolyte management. Intravenous fluid administration represents the cornerstone of parvovirus treatment, as infected dogs typically lose substantial quantities of fluid through vomiting and severe diarrhea. The fluids serve multiple critical functions including rehydration, electrolyte replacement, and maintenance of renal perfusion to prevent acute kidney injury. Veterinarians carefully calculate fluid requirements based on the degree of dehydration present, ongoing losses, and maintenance needs, typically administering balanced crystalloid solutions through peripheral or central venous catheters. Beyond simple volume replacement, attention to electrolyte composition becomes essential, as many parvovirus patients develop significant imbalances in sodium, potassium, and chloride levels that can precipitate cardiac arrhythmias and neurological complications if not properly corrected. Continuous monitoring through serial laboratory assessments guides adjustments to the fluid regimen throughout the treatment course. Antimicrobial therapy and infection control. Secondary bacterial infections represent one of the most serious complications in parvovirus-infected patients, as the combination of intestinal barrier dysfunction and severe leukopenia creates ideal conditions for pathogenic organisms to proliferate. Broad-spectrum antimicrobial therapy becomes a standard component of treatment protocols, with selection based on the likely spectrum of intestinal bacteria that may translocate into systemic circulation. Most treatment regimens incorporate agents with activity against gram-negative organisms and anaerobic bacteria, reflecting the typical flora of the canine gastrointestinal tract. The choice between specific antibiotics depends on local resistance patterns, patient factors, and individual patient tolerance, but the general principle remains that preventing bacterial sepsis significantly improves survival odds. Some clinicians recommend prophylactic antibiotics during the early phases of illness when leukopenia is most severe, while others reserve antimicrobial therapy for documented or suspected bacterial infections. Antiemetic medications and gastrointestinal support. Persistent vomiting compounds the dehydration and nutritional losses associated with parvoviral enteritis, making antiemetic medications an important component of the treatment strategy. Modern antiemetic agents, including serotonin antagonists and NK1 receptor antagonists, effectively reduce vomiting in most cases and allow patients to tolerate some oral intake during recovery phases. Concurrent gastric protectants may be administered to reduce secondary ulceration of the already compromised gastrointestinal mucosa. As the acute phase of illness resolves and the patient begins tolerating oral intake, the transition to enteral nutrition becomes critical for recovery. Many clinicians employ highly digestible diets in small, frequent portions to gradually restore normal gastrointestinal function without overwhelming a recovering intestinal tract. Probiotic supplementation is sometimes utilized to help restore normal intestinal flora, though evidence for clinical benefit remains limited in naturally infected animals. Immunological support and bone marrow recovery. The profound immunosuppression characteristic of parvovirus infection creates the potential for catastrophic secondary complications. While no specific therapy directly accelerates bone marrow recovery, several supportive approaches may be considered in severely affected patients. Recombinant human granulocyte colony stimulating factor, GCSF, has been investigated as a means of stimulating more rapid restoration of neutrophil populations, though evidence for clinical benefit in naturally infected dogs remains inconsistent and the high cost limits its use to referral settings. Blood or plasma transfusions may be considered for severely anemic patients or those with evidence of ongoing hemorrhage, providing both oxygen-carrying capacity and antibodies that may offer temporary passive immunological support. The resolution of leukopenia and restoration of immune function essentially depends on spontaneous recovery of bone marrow function, which typically occurs over days to weeks following the acute phase of viral replication. Monitoring and prognostic assessment. Successful treatment of canine parvovirus requires close monitoring throughout hospitalization to assess response to therapy and identify emerging complications. Serial complete blood counts provide objective evidence of bone marrow recovery and help guide decisions regarding the appropriate intensity of supportive care. Biochemical panels assess renal and hepatic function, while blood gas analyses detect metabolic derangements requiring intervention. Clinical assessment of hydration status, mucous membrane color, and capillary refill time provides immediate feedback on circulatory adequacy. Monitoring for signs of bacterial sepsis, including fever, tachycardia, and progressive clinical deterioration, guides decisions regarding antimicrobial therapy escalation. Prognostic indicators that favor recovery include rapid resolution of vomiting, return of appetite, and normalization of white blood cell counts, while prolonged illness, development of sepsis, or evidence of disseminated intravascular coagulation suggest a more guarded prognosis. Duration of hospitalization and discharge criteria. The typical hospitalization period for parvovirus patients ranges from 5 to 14 days, depending on disease severity and individual patient response. Most dogs demonstrate initial clinical improvement within 48 to 72 hours of aggressive treatment, evidenced by reduced vomiting and restoration of appetite. Discharge planning should occur only when patients demonstrate consistent oral intake, have overcome acute signs of illness, and show laboratory evidence of bone marrow recovery with improving white blood cell counts. Even after discharge, continued outpatient monitoring becomes important to detect any relapse of clinical signs or emergence of delayed complications. Home care instructions must emphasize strict hygiene measures and isolation from other dogs to prevent transmission, as recently recovered patients may continue shedding viral particles in their feces for several weeks following clinical recovery. Prevention through vaccination and biosecurity. While treatment protocols have improved substantially over recent decades, prevention remains the most effective strategy against canine parvovirus. Vaccination programs utilizing modified live or inactivated parvovirus vaccines have dramatically reduced disease incidence in vaccinated populations. Puppies require a series of vaccinations administered at appropriate intervals to ensure adequate immune response, while adult dogs benefit from booster vaccinations at regular intervals as recommended by veterinary guidelines. In addition to vaccination, environmental contamination control measures become critical, as the virus demonstrates remarkable environmental stability and can persist in the environment for extended periods. Rigorous cleaning with appropriate disinfectants, proper waste disposal, and separation of infected animals from susceptible populations form the cornerstone of outbreak prevention in facilities housing multiple dogs. Emerging therapeutic approaches and future directions. Current research into parvovirus treatment continues to explore novel therapeutic modalities that might improve outcomes beyond traditional supportive care. Investigations into immunomodulatory agents, antiviral compounds, and enhanced gastrointestinal barrier protective strategies represent promising avenues for future clinical application. Some researchers examine the potential role of specific micronutrients and antioxidant therapies in optimizing immune function during acute viral illness. Additionally, refined understanding of viral pathogenesis continues to reveal new potential therapeutic targets that might be exploited to reduce tissue damage and accelerate recovery. While current treatment remains predominantly supportive in nature, continued advancement in veterinary medicine offers hope for more targeted and effective interventions in future years. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.